Welcome, everyone. Today of treatment, we're going to examine how the classic 4 Ps of marketing, product, price, place, and promotion apply to sexual and reproductive health services. While the 4 Ps originated in commercial marketing, they offer a surprisingly powerful lens for analyzing how SRH services are designed, delivered, and communicated. Our goal is to understand how each element shapes access, uptake, and user experience. Let's begin with a quick refresher. The 4 Ps refer to product, what is being offered, tangible or intangible. Price is not just financial cost, but all barriers associated with obtaining the service. Place is how and where clients access the service. Promotion is how we communicate value and motivate uptake. In SRH, these dimensions interact constantly. For example, a free contraceptive method, price, isn't truly accessible if the clinic offering it is open only during working hours, place, or if users distrust the provider, promotion. We analyze them separately, but in reality, they operate as a system. When we say product in SRH, we're rarely talking about a single item. Instead, we consider a bundle of services and experiences. Think of a young adult seeking contraception. The product is not simply a pill pack. It includes counseling, confidentiality, respectful treatment, follow-up options, and access to alternative methods. Examples of SRH products include contraceptive methods, short-acting and long-acting, preconception and fertility counseling, STI screening and treatment, abortion care where legally available, and postpartum family planning. The product is designed not only to address a biological need, but to reduce stigma, empower decision-making, and provide continuity of care. All SRH products share several defining features. 1. Safety and effectiveness. Evidence-based, high-quality care is non-negotiable. 2. Confidentiality, particularly critical for adolescents or clients facing social barriers. 3. Accessibility, availability of options, clear information, and ease of switching methods. 4. Quality of interaction. Users consistently emphasize provider respect and clarity of communication as central to their perception of quality. I want to emphasize that the experience often becomes the deciding factor in whether a client returns. Price is far more than the listed fee. In SRH, it includes fees for consultations or services, transport and waiting time, lost wages for missing work, emotional costs such as stigma, fear, or judgment, administrative burdens like documentation or insurance processes. For example, a clinic may advertise free condoms. Still, if a client must travel 2 hours, explain their purpose to a skeptical receptionist, or wait in a crowded area without privacy, the actual price is high. Understanding price properly allows us to design more equitable services. There are several ways organizations reduce price-related barriers: sliding scale fees that adjust to income, government or donor-funded programs offering free or low-cost SRH services, bundled services such as integrating STI testing with routine checkups at a single cost, reduced administrative friction like simplified registration or walk-in hours. Each strategy aims to reduce the total burden of accessing care. Place refers to where and how services reach clients. Traditional channels still matter: health centers, community clinics, school-based health programs, but SRH increasingly relies on innovative, flexible models. Distribution channels may include mobile health units, telehealth consultations, community health workers, pharmacies offering contraceptive counseling, or self-testing or at-home sample kits. The overarching aim is to meet people where they actually are, not where we assume they should be. When determining the best location and delivery format, we consider proximity. Are services near the target population? For rural teens, distance is a significant barrier to accessing resources. Privacy. A discrete physical space, such as a dedicated adolescent clinic room, can drastically increase comfort. Convenience. Hours and processes must align with user schedules. Evening clinics or provider home visits can dramatically increase uptake. Place is never just geography, it's also about comfort, safety, and social acceptability. Promotion in SRH is fundamentally educational and trust-building. We're not selling a product, we're helping individuals make informed decisions. Effective promotion may involve public information campaigns, partnerships with schools, youth groups, or local NGOs, social media strategies that speak in relatable, stigma-free language, peer educators who match demographic and cultural contexts. The goal is not persuasion, it's empowerment through information. Our promotional goals often include increasing knowledge of available methods and services, reducing stigma associated with contraception, fertility, or STI screening, encouraging preventative behaviors like routine sexual health checkups, and highlighting differentiators such as confidentiality protections or newly extended clinic hours. Promotion becomes most effective when it reflects local values and listens to community concerns, rather than pushing pre-packaged messages. The consultation is the intersection of multiple P's, especially product and place. A positive consultation environment includes non-judgmental communication, method neutrality, clear explanation of side effects, and support for shared decision-making. Consider a teen receiving contraceptive counseling at a youth-friendly clinic with dedicated privacy protocols. The physical setting, provider attitude, and availability of multiple options all contribute to a cohesive product experience. Mobile health units and pop-up SRH events are transforming access to sexual and reproductive health services. Rather than expecting clients to come to the clinic, providers go to them. Markets, schools, transport hubs, and remote villages. This approach is especially efficient for adolescents, migrant workers, and populations facing legal or cultural barriers. Outreach not only expands geographic place, but also redefines who we consider reachable. The 4 Ps function as an interconnected system. For instance, a new contraceptive method, product, won't be adopted if it's available only in specialty clinics, place. A subsidized price, will have minimal impact if communities distrust the health system, promotion. Telehealth, place, becomes ineffective if clients aren't aware of it, promotion. Successful SRH programs align all 4 elements around user needs, not institutional convenience. Even with thoughtful design, accounts remain. Regulatory constraints, national policies may limit who can provide specific methods. Cultural dynamics, community norms may restrict open discussion of sexuality. Funding volatility, SRH services are often donor-dependent, creating sustainability concerns. Navigating these challenges requires not just technical expertise, but political and cultural literacy. That concludes our session. I invite your questions.